unfortunately can't spend the entire hour with all of you. I wish I could. And I wanted to, at the very least, welcome all of you and to thank you for not only for being here in this very important conversation, but for being ambassadors and cheerleaders and inspirators for all of our nurses across Providence and our entire family of organizations. Having the ability to recognize excellence and to recognize compassion in our nurses is very, very important. I'm really excited that we're able to do this across the entire enterprise, and I just want you to know that I so appreciate you. I appreciate your wisdom, and I appreciate your expertise, and I appreciate the time that you spend in that space. We wouldn't be able to do this without you. So thank you for doing that. Thanks, Gavin, for coordinating all of this again. And Bonnie and Melissa, wish you a great holiday season, and have a great meeting, everybody.
Thank you, Sills. Talk about an inspiring leader. You are so special to us, Sil, and we're so grateful to you for making this really dream come true for us, to know that every nurse who works anywhere within Providence is now going to be eligible for this kind of very positive recognition and feedback. It wouldn't have been happening if it weren't for you and your leadership. So thank you.
Bet. Happy holidays.
Happy holidays. See you soon.
Bye-bye.
I'm sure that there are many of you on the screen who I'm not seeing that I probably have met. I'm Bonnie Barnes. I'm one of the co-founders of the Daisy Foundation, and been here from the very beginning, now 24 years ago since we lost Patrick, and decided we needed to find a way to say thank you to nurses for the extraordinary compassionate care we experienced when he was oh so sick and in the hospital for 8 weeks. Never did we imagine that Daisy would be here honoring nurses in over 6,200 healthcare facilities and nursing schools, not only throughout the US, but also in 40 other countries. It's never was in our imagination that this could happen. And it really does happen because so many of you are making Daisy as important and meaningful as you do for your nurses. You should know that Providence was among the very first hospitals that had the Daisy Award, because at the time Patrick died, we were living not far from what became a Providence hospital, Santa Rosa Memorial Hospital, and was one of our very earliest partners. So our relationship with Providence goes way back, and we could not be more proud to partner with all of you. So thank you. I echo all the things that Sil said with my gratitude on behalf of all of us at Daisy to you. Thank you, Melissa.
Thank you. I am going to start by sharing my screen. My name is Melissa Barnes. I'm the Vice President of Operations here at the Daisy Foundation. And I am very excited to also introduce my cohort here. This is Gavin Strong. He is your system-wide Daisy coordinator, who is really working hard to make sure that you have all of the tools, everything that you need to be successful with your Daisy Award program. We're working in partnership to make sure that you have the support that you need. And as Bonnie said, quick update, since 1999, we have been honoring the extraordinary work that nurses have been doing. And this is in over 6,200 healthcare facilities, schools of nursing in 41 countries, with over 210,000 nurses honored, and really 2.5 million nominations tell us patients and families, they want to say thank you to their very special nurse. This doesn't happen, of course, by us sitting in our homes. This happens because of you and the hard work that you do to create meaningful recognition for your nurses. As we all know, the chief nursing officer is really, nothing happens in a hospital without the chief nursing officer's blessing. So we've learned that well. So we're super excited to have the support of chief nursing officers across the Providence Health System. You, the DAISY coordinators, are the ones who actually make it happen, and we are so grateful. We have learned over the years that we may have made it a lot of work. Sorry about that. But the truth is that you are supposed to coordinate the program. What this means is you don't have to do all of the work yourself. So look for a retired nurse, have committee members, look for your volunteers, have 2 DAISY coordinators. See, get the help that you need to be successful in your organization. We always want DAISY to be a joy, and so many of you have reached out to us to say that this is one of the most favorite things that you do as part of your job at Providence. We want to make sure that that continues by making sure that you have support. You can also include your nurse managers by sharing with them the impact of the DAISY Award. They are the ones who know how to create awareness and excitement in their units. So using them to help leverage your DAISY Award program so that every unit is receiving nominations. And of course, marketing PR support. Some of you have fabulous marketing PR support in your facility or at your regional level. And Gavin is working hard to make sure that at the system level, we also put together tools to make it easier for you to create awareness. And then at your selection committee, those who read your nominations and select your honoree. Some ideas for you include somebody from your patient experience team, a representative from your patient family advisory council, a patient family advocate, or a patient or family member themselves. It does not have to be the same person every time. Ask someone from your HR department, your nurse recruiter. They can be taking these wonderful stories of what nurses do and share these stories with potential folk who might want to be a nurse inspired by the extraordinary care that you provide. A volunteer coordinator, even your chaplain. At Swedish Issaquah campus, what they do is they have a volunteer come and collect the nominations for them around the facility. So it's not the DAISY coordinator running from box to box to box. They have all the information entered into a spreadsheet. And then they have the second spreadsheet that has the same stories that is blinded for the committee. And at the end of the nomination period, the blinded stories are then sent to the committee for selection of the honoree. Anyone who was not selected still receives recognition because they make sure that every nominee, receives a pin, a thank you card, and a copy of that nomination. So important. This is a great way to spread meaningful recognition throughout your entire campus. Well done, Swedish Issaquah. At Providence St. Joseph Medical Center, they put together a DAISY playbook and developed DAISY Gardeners Council. I love that. And they are the ones who help coordinate the DAISY Award celebrations. Their council includes nurse directors, nurse managers, educators, education coordinator. Their gardeners collaborate with the Professional Advancement and Retention Council, and it allows bedside nurses the opportunity to be involved with the DAISY Award selection process and celebrations. A great best practice. Their playbook was created by this council to outline the roles and responsibilities of each council member. And nominations are collected and managed by the DAISY Gardeners Council member and transcribed into an Excel sheet for the next steps in the DAISY voting process. I'm really excited to say that the DAISY coordinators at Providence St. Joseph are going to share this DAISY playbook with Gavin as a resource for everyone. Speaking of using that almighty Excel spreadsheet, we do have a sample for you that you can use in the resource center. It's a great way to track those nominations and even those nurses who receive nomination after nomination. In fact, those nurses who are receiving so many nominations, perhaps that is the nurse that should speak to a new group of nurses coming in, or maybe even be the one that a new nurse follows and models after, who's able to express what it is or how it is that they are able to create that compassionate care moments with their patient while still being able to do everything else that a nurse needs to do. Making sure that all units and shifts are receiving nominations. And if they're not, if you have a unit that you don't know how to get nominations for, please do reach out to us. We have a lot of best practices for every unit to be able to receive nominations. And of course, sometimes you have, for example, those patients who line list every single person who helped them. Save that nomination for a potential team award, for example. And prepare for increasing nominations. These are our benchmarks. These are the goals that we have set aside. Now, these, just so you know, were selected before COVID hit, where we took all of our second tier nominations, those who just continually got this number over and over and over again. We took out the outliers who were getting thousands of nominations. We focused on the 100 nomination hospitals. So we do know that these numbers are attainable. You have access, of course, to our resource center. Please do check it out. We have updated our materials. They're fresh, they're bright. We always use thank your nurse instead of nominate. A lot of neat new information in our resource center. There are two questions you really have to be able to answer in order to ensure that nurses are being nominated. How will the patient family know they can say thank you? How will they remember the nurse's name? And not every unit has the same strategy. Some people will put banners with the QR code in their lobby, in their cafeteria, in their elevator bay. They use the trifold nomination form with the pre-printed address to be picked up and then mailed back in. Electronic nomination form with the QR code is another wonderful way. A whiteboard with a laminated little sign that says, want to say thank you to your nurse? QR code works particularly well in places like the critical care, where sure, it's not the patient getting up out of bed to scan that QR code, but their family will. And it's a wonderful way to say, hey, Mom, we love Nurse Lindsay. Let's write this nomination together. Really cementing that positive experience that that family, that patient has had at your facility. And signage in waiting areas, cafeteria, again, inside the elevators, outside of the elevators, and including them on your website and your patient portal. There's also screens that have these. There's rounding tools. There's patient satisfaction surveys, all of these different ways. And if you're not currently using these tools, let us know. We're happy to get you connected. All right, Providence St. Joseph offers a variety of opportunities for their patients, family members, visitors, and caregivers to nominate a nurse for the DAISY Award. They have 4 central DAISY stands located in key areas throughout their facility. Some units also put the trifolds at the front nursing station. They offer a QR code, Microsoft form links, PDF version of the DAISY nomination on their internal SharePoint site for caregivers. They try to make it very easy for anyone to be able to nominate their nurse. And on their external internet homepage, it offers information about the DAISY Award, links for their patients, visitors, and family members to nominate a nurse right there on their website. They also encourage during their nurse leader rounds, how wonderful to have that opportunity when you hear a great story to capture it and use it for a DAISY nomination. And at Swedish Issaquah, each department has a standing box in the entry of the unit. They have a Patients put them in the discharge paperwork packets. That's a wonderful way to collect nominations. And again, you notice both of these Providence hospitals are using different strategies because you have to use different strategies for different units. They also have made it very easy on their website to submit a DAISY nomination, and they are going to introduce business cards with the QR code and the web address for nominations that they can hand out. Gavin and I are working on consistent branding and even putting together a print center, kind of like what Swedish does, so that it can be even easier for you, the DAISY coordinator, to go to a place and pick out what you need for the different units and create that awareness. Celebrating nominees. I love what Swedish Issaquah does. This is absolutely a form of meaningful recognition and a wonderful way to really spread, again, that recognition out. Giving them the nominee pin, the thank you card from your leadership team or from your DAISY committee, and then making sure that you give them the actual nomination, what was written to them about them. And then we have a way down the road for you to recognize those who receive nomination after nomination. This works beautifully at a special pinning ceremony during a celebration or maybe around Nurses Week, Nursing Excellence, where you can call upon these nurses and give them their special pin. Presentation best practices. We ask that the Chief Nursing Officer always be the one who gives the DAISY Award. You may also wish to invite your senior leadership. They may not all be able to attend every presentation, but it is so important that somebody from the hospital's leadership team be there to represent the hospital. Considering inviting the family of the nurse who you are giving the award to so that they can be so proud of their loved one receiving this recognition. Considering inviting the person who wrote the nomination. Our experience, patients and families love to come back and say thank you to their special nurse. Please do utilize our presentation checklist and our guide to presenting to ensure that you are having the best presentation you can. At Swedish, they always include their upper management, and department managers also attend. Individual who submitted the nomination, peers, caregivers, and hopefully, whenever possible, the honoree's own family attends. The CNO always presents the DAISY Award. They send the honoree all of the pictures that were taken at the event, which is wonderful. I had one DAISY honoree tell me it was like being married. It was just a blur. They couldn't remember anything except for how they felt, which was wonderful. Publish the event on their campus and multi-campus communications, as well as on our DAISY website. They add the recognition to the performance review site, and it can be seen by the honoree and their manager. And of course, forwarding to the honoree the information about their benefits that they receive now that they are a DAISY honoree. At Providence St. Joseph, they celebrate approximately once a month, and they also include their nursing and executive leadership team, their education, PARC, and honorees unit. To the celebration, they have a DAISY card. I'm going to show you a picture in just a second with DAISY flowers. They have the laminated nomination. It looks really nice when they present it. They have the certificate, the cinnamon rolls, but of course, during the celebration, they have the individual photo and they have group photos to share, not just with the DAISY Foundation, but also with their internal and external sites. They continually celebrate their honorees and nominations by posting laminated daisies around the unit for everyone to read and create those care models. And here are some pictures. I was lucky enough to attend one of these presentations. It was really special. After the presentation, please register your honoree. We create what we call a spotlight that lives on our website. and this allows them to receive their benefits. These benefits include Chamberlain University reduced tuition offer if they want to further their education. They get to apply for or renew ANCC certification at a very special rate, an invitation to apply to Sigma. And then they also are now eligible for Healing Hands Nursing Conference Scholarship. They can go to a conference of their choice. Honorees are eligible to be nominated for the Daisy Award for Extraordinary Nurses and Patient Safety, and they can apply for medical mission grants. So with this continual celebration, so many of you already do this. It's so great to see on our social media that you present that presentation on social media. Please be sure to hashtag us. We're happy to like all of your postings. Use in-house technology so that visitors, patients, families, they can see all of the right. They can read these wonderful, compassionate stories of care happening right there in the hospital. Use print media to showcase your nurses, and you can celebrate on each unit the nominees, for example. And of course, we hope you will use all of your external communication options and share with your community, including a wall of honor, or as one nurse called it, a field of daisies. What I love about both of these different walls here is they include a snippet of the story so that a passerby knows exactly why this specific nurse was chosen. We hope you will also grow your DAISY Award. We have, of course, the DAISY Award for direct patient care nurses, but we also have the Team Award, nurse-led, nurse-driven, but it takes a whole team, including non-nurses. We have the Nurse Leader Award, which is a wonderful addition. It's a great way for nurses to be able to say thank you to those who lead with compassion, those who support compassionate care at their bedside. We have a new ethics award for those nurses who really do the right thing for their patients and families. We have a DAISY Award for advancing health equity, those nurses whose work includes, touches upon the social determinants of health. We have our Faculty DAISY Award and our Student Award, both usually for a School of Nursing, but certainly available to hospitals to recognize those nursing students that are at their school. And I'm super excited to let you know that the Faculty Award is evolving to encompass all of the ways that nurses are educated and their professional development occurs. So we're evolving the Faculty Award to the brand new DAISY Award for Nurse Educator starting in January of 2024. So stay tuned for more information. You will be receiving a lot of information about this new category. Please sustain your DAISY Award program by checking that resource center. Please meet with us. We are 100% here to support you and your work. You can consider opting into our text messages, and we are here to support you at any time. I do want to let you know that open right now is the DAISY Award for Extraordinary Nurses and Patient Safety. Any DAISY honoree, including your teams, that has a wonderful patient safety story attached to it is eligible. Health Impact DAISY Nurse Leader Award for Policy for those nurses who are doing great work out there, changing healthcare for the better. And we have brand new our ANA DAISY Awards for Ethics in Nursing Practice and Leadership. There's 2 awards, one for a clinician and one for a nurse leader. We hope that you will go to our website and learn more about these. We also have our grants program open right now. Our J. Patrick Barnes grants for research and EBP projects are open for all nurses for research and focus on patients with autoimmune disease or cancer. We have our health equity, which supports the delivery of patient family-centered care of disadvantaged populations, designed to address social determinants of health aimed at improving health outcomes. And we have Improving Care and Promoting Healthy Aging of the Older Adult, sponsored by Alan Lynch Hendrick Charitable Fund. We also have the DAISY Medical Mission Grants open to all DAISY honorees. Is your program team. Chelsea is in the states listed next to her name, and Nicole is listed to the states next to her name. We do hope that you will definitely reach out if you have any questions at all. A huge thank you to Providence St. Joseph Medical Center and Swedish Issaquah campus. Here are their DAISY coordinators, Sandy, Stephanie, Debbie. Thank you so much. When I reached out to you, you jumped up to provide me with examples of what you do. So you are now resources for other Providence members to know that DAISY is alive and well. And thank you to all of you. This truly, truly could not happen without you and the work that you do. There are so many wonderful, wonderful DAISY Award programs out there. I visit you often, as you know, and it is such a privilege every time I get to come and see you recognize one of your extraordinary nurses. So thank you all so very much for the work that you do. Now, Gavin, I'd like to turn it over to you and see if you have anything that you would like to add, and then perhaps we can open it up to folks and their comments or questions.
Yeah, thank you, Melissa. I guess I'd just like to add that we're really excited to, with this last year, doing the system-wide contract for Providence and DAISY, to make it less expensive for you all and easier to use. I'm also just so excited that we get to sort of work together as an organization, do things like this to share best practices. It's such important work. It's such important recognition. So being able to share what's working in what areas and just make improvements is really exciting. We've also got some good work going for next year. Melissa, you kind of mentioned some of those print resources and stuff that will be debuting in 2024. So yeah.
Absolutely. And then I would love to have some feedback from some of you if you want to tell us something that you love about your DAISY Award program that you're doing that's really successful. If you have some kind of a problem with your DAISY program, or a unit maybe is a little bit trouble getting nominations. But just really want to open it up to you now and have your opportunity to talk.
I'll start, Gavin. Hi, it's Marlon. Turn my camera on. From Providence St. John's in Santa Monica. Two questions. With the system level coordinator for the DAISY program, does that mean we will standardize how we do DAISY awards, or are we still doing our own ministry-based program? Meaning, St. John's, we hand out 16 awards every year. I don't know if all the other ministries do that. And also, in terms of ordering all the supplies that we need for the awards, will that be coordinated through the system? Second question is, we've had problems with our DAISY program the past 2 quarters. And so we asked our Professional Advancement Council to take this over. And they are very willing and very excited to take it on. So I just wanted to ask my colleagues here if there are any ministries out there who has a direct care nurse, not necessarily an educator, not someone hired to be part of the education department, not a manager, but a direct care nurse who runs the DAISY program.
All right, Gavin, if you want to take the first question, I'll take the second.
Definitely. We're not standardizing or making you change the way you do your awards at all. The only thing changing is we're hoping to provide better communication between ministries and highlight some of the areas where it's working really well so that you can adopt practices if you'd like to, but no for changes, standardization, anything like that.
Yeah, definitely. And then to answer your second question, a direct patient care nurse, well, I do want to hear if anyone else has a direct patient care nurse running their DAISY Award program. My only caution is that in my experience is direct patient care nurses have full-time jobs. You get into trouble with overtime regulations and rules. So you'd have to be really careful to build it into their job description, or to make sure that they're really clear on what it is that they should be doing. And I certainly would partner them up with like an administrative assistant or someone else as well. But does anyone else have any advice, or have a successful model?
Lisa, this is Sandra from Providence, Willamette Falls. And before I took this committee over, it was led by one of our bedside nurses from ICU, and she had done it for years. And it seemed to be pretty successful. And we also have, so we have a committee, and we have 3 nurses. Let's see, one from MedSurg, one from the ED, and one from Birthplace, and our chaplain that sit in the committee. So they do get to participate.
Fabulous. Yeah, and I think the most important thing of all that I hear from many of you is having the heart to want to be the DAISY coordinator. That tends to make the magic happen. Does that help, Marlon?
Yeah, it does. Thank you.
Thank you very much. Danny, did you want to add something?
Oh, sorry. Hi, I'm Jamie Sloan. I'm the DAISY coordinator at PPMC here in Oregon. So we have a direct care nurse as a co-chair on our committee. And then we also have direct care nurses and other ancillary members that vote on the DAISY award. And so just wanted to kind of share that. And it's been pretty successful. Super engaging committee, and everybody is really, really excited to celebrate great work. And so it's one of the funnest committees. I know funnest is not a word, but one of the great committees that I get to co-chair. So yeah, thank you so much for your program. We really, really, really love it here.
Oh, thank you. And that's fantastic. When DAISY very first started, it truly was, it was led by direct patient care nurses. We're the DAISY coordinators. So I think as long as they have the support and you give them clear direction of what the expectations are, I think that that's just wonderful for them to be a part of it. And especially when they have that enthusiasm, it doesn't get better. So anyone else have anything that they would like to share? I know a lot of you have really great DAISY programs. Anything that you want to share that you do really well that you're proud of?
I think just to say thank you, Melissa, for everything. I am new to the DAISY coordinator role, and I'm kicking this off at Cadlick Regional Medical Center in January, but have been a part of getting this up and going at St. Mary in Walla Walla this past year. And it's just been so much fun. Love the ceremonies. So yeah, it's been really great. So looking forward to it. So just a thank you.
Thank you very much. Yay, Providence, Walla Walla. My great aunt is there, was a patient there, nominated her nurse, and of course had to send it to me, and was really quite cute about it. So thanks for taking care of people.
That's awesome. Thank you.
Are there any challenges that anyone has? Because what we really want to do is we want to have a safe space where there's no judgment, but we know that sometimes there can be challenges to a program of how do I find the time, or how do I organize, or can I pre-select before I give it to the committee? This is the kind of place where we want to create a community of DAISY coordinators where you can ask each other, you can ask us, and we will help to get your answers. Go ahead, Deborah.
Hi there, it's Debbie from Tarzana. So we have gone to kind of the pre-screen, because some of our nominations were, they brought me my coffee. And so we want to make sure that it's substantive and using the pedal form to evaluate them. So we have gone to a bit of a pre-screen. Doesn't mean that they're not valid and we still type them up. But before we turn it in for our blind review. we typically do pre-screen them. So, and I think it's been a little more meaningful and impactful when we're able to read through the ones that are a little more juicy. So
Right.
that's been something that's worked well for us. We do have a bit of a struggle still in our procedural areas getting nominations because our patients are all asleep and the family members don't necessarily know what happens when they're in a procedural area. So that's one space we're still looking to develop.
Excellent. Yes, peri-op is pretty good to get nominations. Post-op is a little bit more shaky if hopefully absolutely nothing goes wrong. And when that's the case, then there is no interaction and it is difficult to do that award. But it's the actual in the operating room when the patient truly is out and the nurse is never going to talk to that person. Those are great opportunities, for example, for a team award, especially when you think about those extended surgeries where they went hours and hours and hours over the time they were supposed to go. And yet everybody on that team is working hard to save that person's life. That is extraordinary. Nothing more compassionate than saving someone's life. So looking at some of those stories for team awards is a great way to recognize those OR nurses where they're leading the compassionate care, taking care of that patient, but sometimes it's a marathon surgery, or maybe they point out there's a sponge that has been misplaced and they find it later, or whatever the scenario is. So just making sure that people know fellow staff members can write nominations as long as they're about a specific patient family story. So if a nurse in post-op, for example, sees another nurse saying, uh-oh, there might be a problem here, and getting the doctor and making sure and adjusting something, and maybe the patient never knows because that nurse took care of it before the patient ever had to know. And that is a beautiful, compassionate story. I recently went to a Daisy Award presentation where a nurse noticed after surgery that one of the patient's legs was a different color than the other leg, and got the physician and made the physician come, and they did a diagnosis, and the physician wrote in the nomination saying that the nurse saved that person's leg because they noticed that. That is something that if they hadn't have noticed it, they wouldn't have really gotten in trouble. But they did notice it. They took the time, they called the physician, they made it happen, and they took care of that patient. That's an extraordinary story. Making sure that your doctors and physicians do know about your Daisy Award program, because they may not read the signs that are on the walls or read your inter-office mail, but they will read something that you send to them. So even if you have a doctor-physician email list, that you can send something that says, hey, don't forget to nominate your extraordinary nurse when they go above and beyond for your patient or patient's family. That's another great way to get nominations in some of these areas that are a little less visible to the patient family.
Great, thank you.
Yeah, does anybody else have any other ideas?
Oh, Melissa, I have Marlon again. I have another question.
Oh,
A while back, I was informed that Press Ganey can actually attach the link to a Daisy nomination. Is that currently in place?
yes. So what it is that when Press Ganey goes to send out the patient satisfaction, at the bottom of the cover letter, there is a place that says, want to say thank you to your extraordinary nurse, nominate them for the International Daisy Award, gives a link to our website, but it has a QR code to their nomination form and the URL address, so that not only you might potentially get more Daisy nominations, but also now you've set that person's mind to be thinking about, oh yeah, I guess I did have really great nursing care. Let me fill out this patient survey. So it can be a real win for your organization. All you need to do is talk to your Press Ganey representative at your hospital, and they can add that.
Super, thank you.
Melissa, there's a good question in the chat from Annalie, mentioning that at Seaside, they do get a lot of nominations with things like nurse is very happy and a great nurse. And then they tell the nurse they nominated them. And Annalie asks, what do you do to recognize those nurses?
Absolutely. So there's a couple of things here to think about. One is if you are continually not getting nominations that don't have enough story to them, take a look at how you are asking the question. Are you make sure that the verbiage on your nomination form is share your story, tell us the details of what your nurse did that was extraordinary, or whatever, however that verbiage needs to be to tighten that up to elicit more stories. Have sample stories on your nomination form. So I know we include it on our electronic nomination form. If you have your own electronic nomination form, include a sample story. People read that little sample story and it's like, oh, they want my story. Let me write some more here. So sample stories are a great way to get better quality stories. Another thing to also think about, the patient, family, whoever wrote that nomination is telling you that that person is their DAISY honoree. They just may not be able to express it in a way that you are going to say, okay, it's going to be the hospital's DAISY honoree. But if you approach it as this nurse is already a DAISY honoree and you give them that nominee pin, the thank you card, and you give them the copy of the nomination, you do it at the next unit meeting or nursing huddle that you have by the nurse manager in front of their peers, that is meaningful recognition for them. And it's really important that they understand that just because the patient wasn't able to necessarily write as much as they meant, the fact that they took the time to write the nomination means that that nurse made some kind of human connection with them. And they felt compelled to write about that nurse because of that. They are telling you that nurse is extraordinary. You just may not know the whole story. So recognize them as nominees as they should be recognized. Does that help? Oh, and I just looked at chat. I love the picture of your cart. That is phenomenal. I think it'd be great, Gavin, if everybody sent you a picture of their cart and we could like do something like have the Providence cart competition, or not competition, but showcase all of the different carts. There's some phenomenal ones out there.
I know this one is beautiful. It's like it's got the whole like looks like London Garden kind of this whole theme going. It's really beautiful.
Really beautiful. Anyone else have anything that they would like to add? Well, I would love to give you the gift of time, and I would love to say thank you again. We know that it's some work involved in running a successful DAISY Award program. We hope that you find the joy in reading all of those positive, wonderful stories of what nurses are doing. It's amazing the difference that you, the DAISY coordinator, is making out there by running a successful program. And please know we are 100% behind you to support you with any concern, any question, any need. Reach out to either ourselves and Gavin. Providence is very supportive as well to ensure that you have everything you need to be successful. Bonnie, would you like to say some closing words?
Yeah, I just want to say, sitting back here and listening to you, Melissa, you have done our family proud. This was a great presentation. I love the feedback. Always, Marlon, thank you for your excellent questions. Always great to see you. And Gavin, again and again, we are so grateful to you for your thoughtfulness and attention and coordination skills and all that you're going to bring to the program, not to mention your beautiful background of that great library.
Thank you.
So thank you all. This is going to be wonderful to see DAISY really explode throughout Providence. I'm very, very thrilled.
Thank you all so much.
Have a great holiday, everyone. Stay well and safe, please.
Absolutely. Thank you, everybody.
Thank
all.
you.
Bye.